Are you one of those who is suffering from leg pain or calf heaviness or ankle swelling more towards the end of the day? And along with that, maybe you're having large twisted veins over the legs. In fact, they may not even be large. They may even be fine red or blue veins on the leg. And along with that, if you are involved in professions, where you need to stand for long hours, then this video is definitely for you. Varicose veins is the commonest culprit for the symptoms which I mentioned just now. You'll be surprised to know that nearly 80% of the adult population worldwide is suffering from varicose veins. Hard to digest, right? So how do you know that your leg symptoms, the pain, the swelling is due to varicose veins? But there are two things. One, what you actually see. So if the leg, maybe the calf, maybe the thigh, maybe the ankle, they're showing dilated, large, twisted veins, then yes, they are varicose veins. Maybe they are not that large. They are fine, red-like. They are known as spider veins, but that is also a type of varicose veins, maybe the initial stage of varicose veins. Sometimes these veins may not be seen, and there may be some darkening of the skin near the ankles. That too is a part of the same disease pathology. And sometimes there are very bad, very painful, non-healing wounds over the ankle. That too is a part of varicose veins. So what I told you is how do you identify whether you have varicose veins. Now suppose you don't see any of these things on your legs, neither the twisted veins, neither the pigmentation, the darkening or the ulcers. Still, there are certain things which will point to the underlying vein pathology. So if there is pain in the calf, which is more towards the evening, and it is relieved on taking rest, on limb elevation, that could be a vein problem. If there is ankle joint swelling, again more towards the evening, and that reduces completely on overnight rest, it becomes a vein problem. So one need not necessarily see the varicose veins in the legs to have the problem. What exactly are these varicose veins? Veins basically are blood vessels which take impure blood back from the legs to the heart. And there are thousands of veins in our legs. Now imagine a limb, a leg, wherein multiple pipes are going towards the heart. They have walls inside these veins, right from the ankle joint till the groin region. And they are at a distance of 5 millimeters, 6 millimeters apart. Now these walls, they have been designed by nature so that the blood which is flowing towards the heart against gravity should not be coming back. Nature's marvelous architect, we all know that. Now if due to some reason these walls, they become weak, and there are multiple reasons for that, then the blood which is going towards the heart will start coming back. The veins will start getting large, what we call as dilated. They will become twisted, and that is what is referred to as varicose veins. Spider veins is the same pathology, but the size, the diameter of spider veins is lesser than varicose veins. One of the commonest questions that my patients ask me is whether these varicose veins are blockages. Please remember that varicose veins are not blockages. They are the veins wherein the walls have become weak. Blockages of veins is a different disease, different pathology. It usually affects the deep venous system, which is present near the muscles, beneath the muscles, near the bones, and blockages usually occur in the deep veins, and it is a totally different pathology as compared to varicose veins. So let's say that you or maybe a near or dear one is having these large twisted leg veins. How do you diagnose whether these are truly varicose veins or not? Well, of course, you go to your doctor, he or she examines you, they have a doubt. You go in for a test, which is a fairly simple test, absolutely painless test, very easily available, and that is the sonography of the leg veins, what we refer to as color Doppler or duplex scan of the leg veins. It is done routinely by all the radiologists, and it's not really very costly as well. It is a fact that many of the patients of varicose veins, they are afraid to get treated. Nobody wants intervention, maybe a surgery or a laser, and I totally understand that. So one of the commonest questions that my patients ask me, doctor, are there any medications for this particular disease? Well, the answer is there are certain medications. They are known as venotonics. Your doctor can prescribe them. They will help you to strengthen your veins. But then these medications, they only help to tide over the crisis. That is, they help you to reduce the swelling, the pain associated with varicose veins. You can also use compression stockings, but then eventually those faulty veins, they need to be treated in some or the other way. Some of my patients, they are not into using allopathic medicines. They would want to go in for Ayurvedic or homeopathic treatment, and they do ask me whether these medicines will help in varicose veins. Maybe some herbal oils also. Well, the answer is they do help to a certain extent in reducing the symptoms of varicose veins, but then they do not cure the varicose veins. So yes, there is no harm in using them, but whatever is the definitive treatment that needs to be done eventually. So how do you think varicose veins are treated? You may have understood by now that there are faulty veins. The blood is coming back. Pressure in the veins is increasing, and that is what is giving rise to complications. The pigmentation near the ankle, maybe the ulcers which are not healing. It is a basic thing that this particular reversal or the return of the blood flow has to be stopped, and that can be only done by removing the faulty vein. Yes, you heard it right, by removing the faulty vein. Now, whenever I say this, some of the patients, they are aghast. Oh, doctor, you're going to remove my faulty vein. How is the circulation being going to taken care of? There are certain veins which are known as the deep veins, which form 90% of our circulatory system. So the blood which is coming back from the varicose veins, it is going into the deep veins and is being pumped to the heart. Now, nature has taken care of this, but it is not able to prevent the leakage, and all we do by certain treatment is that we remove the faulty vein and prevent the disease from advancing. So the manner or the way in which one can remove the faulty varicose veins is either by surgery, or one can use something known as endovenous procedure. Now, surgery for varicose veins is a traditional method of treating. Of course, it is effective, but then there are scars, it's painful, the recovery period is longer, so it's nowadays not really preferred. Endovenous treatment basically means treating the varicose veins through a pinpoint hole. Now, these endovenous treatments, they are of two types. One, wherein we use heat energy, these are known as thermal techniques, and the second one, wherein we use non-thermal or methods which do not use heat energy, they are known as non-thermal. Thermal includes laser and radiofrequency, non-thermal includes glue and sclerotherapy. Whenever we look up the internet for treatment of varicose veins, we come across laser, radiofrequency, glue, sclerotherapy, and it gets a lot of confusing. I'm sure you are identifying with what I'm saying right now. Now, how does one really decide which of these techniques is superior? Well, to tell you very frankly, this is a topic of debate in many phlebology conferences as well. But then there are certain guidelines which we follow. So the Western world guideline, be it the European, the American, and for that matter even the Australasian guidelines, they have class 1 recommendation for the laser treatment and the radiofrequency treatment. The benefits of laser treatment of varicose veins are many. First and foremost, there are no cuts, there are no stitches, so it is an absolutely painless procedure. Secondly, the patients are up and about the very next day, they are moving around, they are resuming their work, they are reporting to their office, and even traveling, they are driving their vehicles. Thirdly, it is a very effective technique. The long-term results of laser are fantastic. There are multiple studies, umpteen studies in literature which have proven this time and again. One of the commonest questions again my patients ask me is that they have heard or read that even after the laser treatment the veins keep coming back. Well, I would like to point out here that this is an absolute myth. The veins which have been treated by laser, they do not really open up. The chances are very less. It's less than even 5% at the end of 5 years. However, there is no assurance really that newer veins cannot get varicosed. But then there are certain things that one can do to prevent it. First and foremost, one has to look after, manage the weight. If the weight is kept under control, this disease usually does not progress. Secondly, maintain a healthy lifestyle. Do your exercises, do your walking, do your cycling, do your yoga, and you ensure that the calf muscle is pumped actively, thereby reducing the chances of newer veins getting problematic. And third, one can, to a certain extent, maybe use graduated compression stockings. Even the calf compression is more than enough. So yes, laser treatment for varicose veins is a safe and effective treatment, and it is absolutely not right to say that the veins keep coming back even after laser treatment. Do you really think varicose veins is a cosmetic issue? Well, they do make the legs look a bit unsightly, not really good looking legs, right? But then apart from the looks factor, it is very important to realize that varicose veins can lead to certain complications. See, the blood is coming back through the varicose veins, it is getting accumulated, the pressure in the veins is increasing, and the blood is leaking at a microscopic level. So over a period of time, the patients of varicose veins, apart from the pain, swelling that they have, they also develop pigmentation or darkening of the skin near the ankles. And further ahead, this particular skin, it becomes very hard, very tough, what we refer to as lipodermatosclerosis. And believe me, this is a very difficult condition. Even after treatment, this particular skin doesn't revert back to normal, and it becomes a liability throughout the life. Apart from that, there are the notorious ulcers which form on the inner side of the ankle. They're extremely painful at times. If the patient doesn't do the right treatment, then these are very extremely difficult to heal as well. So yes, it is very important to diagnose the varicose veins and get them treated very timely.